Good morning, Mrs. Johnson. I'm Dr. Carter. Can you hear and see me okay? All right, great. Well, pleasure to meet you. We're going to start off with your exam here, but first, before we start, I just want to make sure that the scene is safe around you. So I want to make sure that if you have any boxes near the floor area, I want you to clear those out of the way because you will be standing up, walking around doing the examination, okay? So I have my notebook here. I'm going to be taking some notes along the examination, okay? All right, great. So I just want to make sure I gather consent first. Is it okay if I begin this exam? All right, great. We're going to go ahead and get started. Again, I just want to confirm your location, and I want to make sure that I get your emergency contacts as well, okay? So you are at home at your address down here that's written on the file, correct? Okay, and your emergency contacts as well. Okay, great. All right. So if it's okay with you, we'll go ahead and get started. I want to begin with just taking a quick thorough history just to get your chief complaint. What's bringing you in today, okay? All right, so you've been having some neck pain. I want to write that down. How long has this neck pain been going on? Okay, for about a couple of days. All right, 48 hours. All right, and could you point to exactly where the neck pain is? Okay, so it's on the left side here, closer to your shoulder. Okay, left side. And do you know what may have caused this neck pain? Okay, lifting weights. And do you know what you're doing exactly when you're lifting the weights? Okay. Did kind of a shoulder shrug and you heard a pop or a strain? You kind of felt a strain? Okay, all right. Is there anything that makes this neck pain worse that you can think of? Sleeping on your side, okay. And turning your head, especially when you're driving, okay. And anything that you've done to help the neck pain? Nothing at all? Okay, great. And could you describe your neck pain for me? Okay, sharp. Okay, anything else? Can you think of maybe it's dull, achy, dull and achy as well? Okay, so sharp, dull, and achy for the quality of pain. Is there any pain that's coming from your left side going down into your arm at all? Any of that? No? Okay, great. And could you rate your pain for me on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you ever felt? Okay. 6 out of 10. All right. And how often do you feel this pain? It's pretty constant? Okay. All right. Okay, I think I've gathered enough information there. As far as your chief complaint, I'm gonna go ahead. I want to do a thorough history, so I want to get a little bit more into your family history and a little bit more things. Okay. All right. Could you just tell me a little bit about your family history, mom and father? Are there any major health issues that should be concerned about with your mom or dad? Would you say mom is pretty healthy? Okay. And what about dad? High blood pressure. Okay. How long has he had this? High blood pressure, okay, for about 5 years now, okay. And he's taking any medication, okay. Not sure what it is. He taking it as prescribed though? Okay, great. All right. And I want to dive a little bit into your past medical history. Are there any accidents, automobile accidents, or any other type of accidents that I should be aware about? Okay. No accident. Any hospitalizations at all? None of those? Okay, no hospitalizations. All right, I want to go a little bit into your social history here. Do you smoke or drink at all, Mr. Johnson? Okay, no smoke. And drink about a glass of wine, maybe on the weekends? Okay. And I know you spoke about you injured yourself through working out? How often before you injured yourself? How often were you working out? 2 to 3 days out of the week. Okay. And how's your diet? Would you say you have a healthy, balanced diet? Breakfast, pretty much have enough carbs, protein, healthy fats for the most part. Okay. So you eating out a lot lately? Okay. Fast food. All right. And how many hours of sleep do you get? Okay. 6, 7 hours. Okay. And has your neck pain, has it been causing any issues with your active daily living, brushing your teeth? I know you mentioned drive. Anything else? Okay, nothing else. Okay, I'm gonna do a quick what we call review of systems from head to toe. So I'm gonna just ask you some questions and you tell me yes or no to these questions. Okay. Have you had any headaches at all? Any sharp dull headaches around the side, front, back? No headaches? Okay, good. Have you had any blurry vision at all? Any blurred vision? Okay, none? Great. Have you been smelling okay? You've been smelling your food okay and tasting your food okay? Great, okay. Have you had any chest pain at all? Any shortness of breath, trouble breathing? None of that? Okay, great. No shortness of breath, okay. And any issues with your stomach? Any trouble going to the bathroom? Any bowel movement issues? Any issues there? No, okay. And I forgot to ask, how old are you, Ms. Johnson? Okay, 35. Any issues with your menstrual at all? Okay, no issues there. Great. Okay. All right. I believe we're good with the history. I've taken enough history here. What I want to do is move on to the objective findings. And so this is a part where we're going to stand up, Ms. Johnson, okay? And I want to move my camera back here so you can see me well. And what you're going to do is move your camera back as well, stand up so that I can see you properly, all right? So what we're gonna do, beginning here, okay, is I'm gonna be checking for your gait, okay? So what I want you to do is turn this way for me, and you're gonna walk across the screen here, straight up, looking straight ahead as such, walking across just like that, so that I can see you properly, so that I can check your gait. Can you go ahead and do that for me, okay? All right, great, okay. And if you could, looks great, come back to the front of the screen here where I can see you properly. I want to make sure that I can see your feet. And if you could mirror me and do the same thing as I do, first thing we're going to do is we're going to come up on our toes here, lifting up as if we're doing calf raises here. Good. And then we're going to come on our heels, okay? So stand up on your heels for me as well. Okay, any trouble? Just want to check, make sure you having any trouble doing that. Okay, great. I'm gonna just jot that down here and make sure that I have that properly, okay? All right, and then we're gonna do one last test here. I want you to stand straight ahead for me. Place your arms out here just like that, okay? Any trouble doing that? Just wanna make sure you're not swaying or anything. All right, great. Okay, thank you. You can go ahead and have a seat. We'll return here. I want to begin with the neck issue at hand, and I want to start with a little bit of inspection. So I just want to look around. If you could lift up your chin for me, look up to the ceiling. I just want to check to see if there's any discoloration, any swelling around there. Okay, great. And especially that left side there. Okay, none there. Great. All right. So next thing we're gonna do is some ranges of motion with your neck. At any time, I want you to let me know if you have any pain or discomfort with these movements. Okay. So first things first, what I want you to do is put your chin to your chest for me, just like that. Let me know if you have any pain or discomfort there. Okay. And then next thing I want you to do is look up to the ceiling as far as you can. Any pain or discomfort there? Okay. All right, next thing I want you to do is bring your ear to your shoulder for me, okay? Starting on that left side there, okay? Just like that, okay? Any pain or discomfort there? Was some pain or discomfort, okay? Did that pain shoot down into your arm or did it stay kind of pretty much in the neck area, okay? Stayed in the neck area. All right, same thing on the right side, ear to shoulder for me. Any pain or discomfort there? No, okay. Just a little restriction though, a little tightness on the left side, okay? All right, and then what I want you to do is look over your left shoulder for me just like that, okay? Any pain or discomfort there? Just a little bit, okay? Same, any localized at all, or did it go down to your arm? Okay. No shooting in the arm, okay, great. All right, stay there, all right, okay. Next thing we're gonna move on to is what we call a myotome. So we're gonna be testing strength in certain areas. I'm gonna start with your right hand. I want you to flick your wrist back just like that, okay, with your right hand. And I want you to take your left hand and keep your right hand just like this. I want you to push your left hand against your right hand here, just like that, okay? Did you detect any weakness in that right hand at all? None? Okay. I'm gonna do the same thing with the left hand. I'm gonna push that wrist back as far as we can. Take your right hand, push up against your left hand. Just like that. Yep. Any pain or discomfort? Notice any weakness there? None? Okay, great. I'm gonna go back to the right hand. I want you to curl your arm here just like that, and your wrist. Yep, just like that. Okay, great. All right, and then what we're gonna do here is I want you to pull back with your left hand. I want you to push against your right hand just like this, okay? Good. Any pain or weakness there? No? Okay, same thing. I want you to bend your arm and your wrist. I want you to take your right hand, push against your left hand just like that. Any pain or discomfort there or any weakness? None? Okay, great. That's good. All right, next thing I want you to do is bring your right hand and your left hand together just like this. I want you to pull apart as hard as you can, okay? Just like that, yep. Any pain or discomfort there, any weakness? No? Okay. All right, last thing I want you to do is put your hands up just like this for me. I want you to pull your fingers apart as far as you can, just like that. Yep, great. All right, any pain or discomfort or weakness detected there? All right, great, okay. So we're gonna move on to some special tests, okay? What I want you to do here is looking straight ahead. I want you to have your hands flat out upwards, right on your lap here. Sitting straight up as far as you can. Good. And I want you to bring your chin to your chest for me, just like that. And let me know if you feel any pain or discomfort in the neck area, okay? Any pain there? No pain, just some pulling, okay? Just pulling the muscle, all right? All right. The next test I want you to do is I want you to turn, look over your right shoulder here. And I want you to take your right hand, place it on top of your hand. I want you to place your left hand on top of your right hand. I want you to place downward pressure onto your neck area, just like that, okay? Let me know if you feel any pain there. Okay, no pain? All right, I want you to do the same on your left. Look to your left here. Right hand over left, and place downward pressure there. Any pain or discomfort there? Okay, just a little bit on the left side. Okay. All right. And the last test I want you to do is you're gonna be looking back for me, starting here, looking up, and then I want you to tilt your head to the left here, just like that. Right over left, and I want you to place firm pressure down, just like that, okay? Any pain or discomfort there? Was pain, okay? Pain and discomfort there. All right, and I want you to do the same thing on the right side. I want you to look back for me, extend, And I want you to tilt your head to the right, place right over left, and downward pressure. Any pain or discomfort there? None? Okay. All right. Mrs. Johnson, I believe that completes our examination. So just want to gather my notes here. And pretty much just want to share my findings with you after getting a thorough history of everything and doing an examination from top to bottom. After getting your subjective and getting your history, I noticed you've having some left-sided pain, neck pain on the left side. You injured yourself when you were lifting weights. Okay, there's no shooting pain or any pain in the right arm here. But I did notice with your ranges of motion, you were restricted on that left side a lot with your lateral flexion and your left rotation. There was some pain there, okay? And you also had a few positive ortho tests, which gives an indication that you may have some structural damage on that left side there, what we like to call cervical facet syndrome. And all that means is that you have some joints in your neck area here, and those joints have been inflamed and injured due to you lifting weights, okay? And I will also say that you may have some strain to the neck muscles, specifically your trap muscle, your mid trap, because it's close to the shoulder here, okay? And so that's pretty much your diagnosis from the information that I've gained, okay? So our next step here is, as far as treatment goes, what I like for you to do is start off with icing, 10 minutes on, 10 minutes off. And I want you to do that for a duration of 30 minutes, 3 times a day, okay, for the next 2 days, because I know you stated that you haven't done anything to help with this issue. Icing will be a great start. It definitely helps with the inflammatory process, which is what you're going through right now, okay? And next thing I want you to do is also, if you have any type of massage lotion, any icy hot, or any biofreeze, you can place that on there to help give you some therapeutic relief as well in that chief area of complaint there, all right? And for the most part, I want you to take a break from lifting weights until we have resolved the pain issue, okay? It'd be best to withhold working out until you feel better. And so I want you to do that for the next 2 days, and we're gonna check back in. I would like to get you into the office and also begin to treat you from a chiropractic standpoint. I'd like to give you a chiropractic adjustment. I believe realigning that spine would definitely help place some stress off of those muscles and joints as well, and help get you to a speed of recovery, okay? All right, so that's pretty much it. Before we leave, do you have any other questions for me? Okay, great. Well, again, remember to follow up with us in 2 days. Again, those instructions as far as your treatment plan goes. I want you to ice, do that for 10 minutes on, 10 minutes off. I want you to apply any type of biofreeze or anything in that nature. You can do that 3 times a day as well. Get much rest and refrain from working out for the next 2 days. Follow back up with us. We want to get you into the office, get you adjusted, get you to feeling better, okay? All right, Mr. Johnson, well, thank you so much. You have a good day, and I will talk to you soon. All right, bye-bye.